Myself, Dr. Vasudev, Assistant Professor from Department of Panchakarma, Yenepoya Ayurveda Medical College. Today, we will be discussing regarding the procedure called Udvartana. Specific learning objectives to explain the procedure of Udvartana, to understand the indication and contraindication of Udvartana, to know the benefits and probable mode of action of Udvartana. Definition: Udvartanam Gatramardhanam or Urdhvartanam Udvartanam or Udvartanam Kashayadi Gatra Karshanam. This is the reinformed rubbing of the body by Churna is called as Udvartanam. Urdhva means upward, Vartanam means to move. This is Udvartana is a Bahir Parimarjana Chigilsa which is done in the Pradhiloma Gadi. Here in Udvartana, there we will be doing the upward massage of the body with different kashaya mixed with different churnas. Udgarshana or reinformed friction. Here it is defined as Udgarshanam Asneha Ushada Churnadibhi Garshanam. Rubbing the body with powdered medicines without mixing oil or other liquid is considered as Udgarshana according to Shushrutacharya. Benefits of Udgarshana, which is Vada Shamaga, Kandu Spoda Pidaga Nashaga, Toggada Agni Vardhaga, and stimulates Brajaka Pitta. Utsadana or rubbing. Sasneha Kalkena Udgarshanam Utsadanam. Reinformed friction of the body with drugs containing sneha or medicines mixed with oil or other liquids in the form of kalka is called as Utsadana. Utsadana and Udgarshana causes dilatation of Shiramukha and increases Brajaka Pitta. Indications: as Dinacharya and Varsha Ritucharya, Medura person, Shodhana Purva Rukshana, obesity, diabetes mellitus associated with obesity, initial stages of MND, Parkinsonism, muscular dystrophy, multiple sclerosis, etc. Skin diseases having Kapha and Pitta dosha predominant. In all these conditions, we can go for Udvartana Chikitsa. We have to select the drug which is suitable for the specific condition. Contraindications: Durbala, Adikrisha, Adiruksha, Vriddha, Bala, Garbini and burns. These are the different conditions where Udvartana is contraindicated. Here, Durbala, Vriddha, Bala, Garbini, in those conditions, if we are giving Udvartana, the patient cannot sustain the procedure. Especially in Adikrisha, Adiruksha conditions and all. Again, if we are giving Udvartana, there will be an aggravation of Vada dosha. So we have to avoid these conditions for Udvartana. Procedure of Udvartana. Best time for Udvartana is in the early morning between 5 am and 9 am because in the daily regimen it is mentioned before bath. So according to Dinacharya, we have to undergo the Udvartana procedure before Snana. Coming to the Purva Karma, first Sambhara Samgraha. What are the materials required for Udvartana Chikitsa? Here first one is frying pan, dhroni, gas stove, spoon and the specific churna for the procedure. Adura Siddhata or preparation of the patient. Here patient is advised to pass natural urges before attending the treatment. Dashavida Pariksha should be done properly. Patient is examined for rashes and skin lesions. Patient is made to lie down in supine position on dhroni. Abhyanga is performed, which is optional. Doing Abhyanga is not mandatory for all patients. Udvartana is done in opposite to hair roots with slight warmed churna. Coming to the Pradhana Karma, Udvartana is done in opposite to hair roots with slight warmed churnas. It should be continued in all the 7 postures which we have discussed same as that of Abhyanga. The first posture is sitting, then supine, right lateral, prone, left lateral, supine and sitting. Paschatkarma. After the procedure, churna should be cleaned from the body of the patient and patient has to be advised to take rest for 15 minutes. After relaxation, advise the patient to take hot water bath and then Rasnadi Churna can be applied over the Murtha. Next, coming to the precautions. Care must be taken to maintain uniform pressure throughout the procedure. Too much pressure should not be applied. Churna should not be too hot. Duration. Duration of Udvartana is not mentioned by any classics, so we have to follow the timings of Abhyanga. Generally, in practice, it should be carried out for 30 to 45 minutes. Course of Udvartana. Udvartana can be continued till 7 days or 14 days or 21 days. Especially in neurological condition, we can go with Kola Kulathadi Churna. Skin diseases and obesity, we can use Triphala Churna. Eczema, Dadru, Pandu, diabetes mellitus associated with itching, skin diseases and all, we can use Nalpamaradi Churna or Nimbadi Churna. Adisweda, Ushira, Chandana, Musta, Padma and all can be used, which are Shida Virya Dravyas. In Kushta condition, powders of Nimba, Kadira, Gudiji, Aragoda, Karanja and all can be used. Next, other conditions like in obesity conditions and all, we can go with Triphala Churna, Kulatha Churna, Mudga, Yava and all can be used. If the patient is having dry skin or prone for rashes, at the beginning we have to go for Abhyanga with Panjamla Taila or any other Taila suitable. Then Udvartana has to be carried out. Mudga Churna and Kulatha Churna can be taken in equal quantity for doing Udvartana. If the skin of the patient is very soft and sensitive, then Kulatha Churna or green gunpowder, that is Mudga Churna, make paste with decoction of Triphala, then we can go for Udvartana. Or if the patient skin is oily or in normal skin conditions, we can use 30% of Triphala Churna and Kola Kulathadi Churna 40% and Kottam Chukkadi Churna 30%. In this combination we can use in the normal conditions. Therapeutic actions of Udvartana. Udvartanam Kafagaram Medasa Pravilayanam Sthirigaramanganam Tok Prasada Karamparam. According to Acharya Charaga, Udvartana is Daurgandhyahara, Gauravahara, Tandrahara, Kanduhara, Malahara and Arujihara. And when we will move on to Acharya Shushruta, Shushruta has mentioned Udvartana is help for Vadahara, Kafa Vilayana, Meda Vilayana, Anga Sthiragara, Tok Prasadagara, Kafahara and Tok Mardavakara. And according to Vagbhatacharya, Meda Vilayana, Anga Sthiragara, Tok Prasadagara, Kafahara. These are the different actions of Udvartana explained by different acharyas. Now moving on to probable mode of action. Effect of pressure in Udvartana. Deep pressure enhances the venous circulation and lymphatic drainage. It also gives stretching effect on superficial fascia that reduces congestion and nodular formation. Effect of vigorous movement in Udvartana, which emulsify the fat in the superficial connective tissues. Effect on alimentary system. When it performed over abdomen, stimulates the intestine, which helps for elimination of waste product. The virya of specific drug used in upward massage helps to remove the excess fat and toxins. Udvartana improves blood circulation and also it improves the metabolism. It absorbs excess oil from the skin and opens the blocked pores and helps to relieve the stiffness. It helps to exfoliate the dead cells and increases the luster. Thank you.